having a nice summer. We have a full agenda today with our CRISP team on. So we don't have an icebreaker, but please still take your time and put your name and your organization in the chat. And if you would like, if this is your first meeting, you can also introduce yourself. For purposes of today, we've also, because this is such a topic that crosses all of our sectors and all of our work groups, we've extended the invitation to our behavioral health work group, our health equity work group, and our healthy eating active living work group. So if you're from one of those and joining CCC for the first time, thank you so much for joining. Dr. Carter, do you have anything you wanted to say to open up a meeting before we introduce CRISP?
No, I'm just happy to be here. I'm glad everybody can come, and I think this will be a really interesting meeting.
Excellent. So yes, like I said, for today, we have our presentation from CRISP on their social determinants of health tool and their referral tool, and then we'll open it up to questions and then close with the community announcements. And just as a reminder, the CCCT vision is that Prince George's County is a place where everyone has access to high quality and effective healthcare services that are well managed, seamless, and tailored to their specific needs. And our mission is empowering healthier lives through efficient care coordination with a strategic systems approach. With that, I can welcome our guests, Michelle Naram, Christian Metzger, and Noreen Elahi. Thank you so much for joining today, and I will stop sharing so that you can join your screen.
Thanks so much, Kimberly. Thank you all for having us today. My name is Michelle Norum. I'm a project manager here at CRISP, Maryland. And as my colleague speaks, I'll then have them introduce themselves. But I'm going to start just giving you a general overview of CRISP for those of you that don't know, and high level kind of the tools available from our social determinants of health. And then I will turn it over to Noreen. I will turn it over to Noreen then to give a demo of our system. Just a reminder if everyone could mute if you're not speaking. Thank you. All right, let me share my screen. Everyone see my screen okay?
Yes.
All right, perfect. Thank you.
Yes.
All right, so here I just wanted to I'm going to go through these slides really quickly just for some of you that do not know what CRISP is. So CRISP is the Regional Health Information Exchange for the state of Maryland, or as you may hear, the HIE. CRISP also serves as part of CRISP Shared Services in West Virginia, DC, Connecticut, Virginia, and Alaska. And I believe we have 2 other states coming on here shortly. And our goal really is to be able to use technology and different data to be able to bring it all together into one place to inform and collaborate and help overall treatment of our patients. So the information that we receive it from all acute care hospitals in the state of Maryland. And then we have over 18 million unique patients in our index. And we have about over 350,000 patient searches each month as well. How do we receive our information? So we receive the information in CRISP in a variety of different ways. So it's through hospitals and health systems, that's through those daily encounters. So whenever someone's admitted or discharged from a hospital, labs, diagnosis, the clinical care notes, all of that information is sent through. We also receive claims-based data from Medicare, Medicaid. We receive direct feeds with LabCorp and Quest. And then if anyone is a CRISP participant, they can also send in patient panels of different information and pull that all into CRISP, and then that goes out to CRISP participants. And CRISP participants are just those who have access to CRISP. So we've really focused mainly on that medical side of things. But we've really now turned the last, I would say, 3 to 4 years, our focus is more on also incorporating the social needs information into CRISP as well to get that full patient care experience and information and helping that from a holistic standpoint. So how are we doing that? So we have that clinical data that I just shared with you. And then we also pull in specific social needs data and then the social care intervention data, such as referrals, and pulling that into that whole person record. And then we send out that information based on, depending on if you're a HIPAA covered or non-HIPAA covered entity, you have different access to what you can see, but you do have access to certain things depending on that. I'm going to skip a couple slides because I know everyone on this call is probably aware of this, but we all know that 40 to 60% of our health outcomes are driven by patients' social determinants of health. And that's really, those community-based services are really a key to driving and improving healthcare in many different ways. Okay, so I wanted to first start with, we have screening tools. So social determinants of health screening tools in CRISP, and we also capture Z codes. So Z codes are what providers may give someone to show that a social need is there. So we've done that in a couple of different ways to pull in those assessments. I'm going to go to the next screen here. And Noreen will show you exactly where this is within CRISP, as well as how to access it. So here overall is what it looks like. On the left side is within our portal, it shows the social needs data tab. Once you would click on that, you would see here in the middle the assessments. If you hit on conditions, that would show any Z codes. Assessments then show by the date that the assessment was completed, and then who the source is. So normally that would say the name of the organization. This is test data for you all, so that's why the source is just kind of these numbers here. Description is the name of the screening. If an organization is using a standardized tool, such as the AHC, which is the Accountable Healthcare Communities Health-Related Social Needs Screening, or if they're using the Prepare, which is another standardized tool, or if they're using maybe a unique one to an organization, it would say that unique organization's name. For example, MedStar has their own, so it would say MedStar SDOH Screener. If you see this little flag next to the screener, that means that a need has been identified. And so that's really when working with a patient to be able to say, oh, I see that a need has been identified. Let me see, specifically click on this one. The other ones, no need has been identified. So you would click on the one with the flag there, and then everything is separated, no matter what the screener is, by 13 different categories. So example, housing, food, transportation, those are those core categories that we map each question to. And then there's a flag based on the category as well as the question. So as you can see, this person had issues under housing due to mold and lead in paint or pipes. And then they also had an issue with food, or a need identified with food. So you'd be able to look at that and then be able to connect them to the resources they need. So this is the one way we receive screeners. So is working directly with an organization to send us a direct feed of their screening information to CRISP. And that's all kind of done on the back end, and we map that all to our system, and a daily file is automatically sent to us, and we upload that information as it comes in. Or we also have available a direct entry screening tool. So we see many times community-based organizations will use this. We also have like care navigators, or people that are out in the field that don't maybe have access to their EMR, or want a quicker way to be able to complete a direct or a screening tool, or maybe someone's screening tool is not electronic. Many times they'll use this to be able to enter that information in, and it will appear exactly the same way that I just showed you in the previous screen. So this is just examples of what it would look like. We do have those standardized tools already uploaded in here. So for example, the AHC and the Prepare, as well as some of those other individualized tools. You would just click on it and then pick through the answers and hit submit, and that would be viewable. That's a little bit about our screening tool that we have. Then we also have a couple of different ways to identify resources within CRISP. I'm going to show you that in a little more detail here, but I wanted to talk about how we get information into the system first. So we do that in a variety of different ways. So one of the ways is through an actual provider system. So that may be connecting with a CBO, and they have their own referral system. And so we'll connect directly with that and share their referral information. It may be, right now we have a project that we're working with DHS where we're working on bringing in the SNAP data. So we might show that information. That's one way. Another way is through network referral platforms. So those would be examples, Find Help, Unite Us, those larger referral platforms. Will work with them to pretty much send us a copy of their referrals that are completed in their system and show that within CRISP. And then we also have our own closed loop referral tool as well, which is really what we're going to be showing you here next. But all of that information then feeds into CRISP and then back to the care team to be able to see the status and referrals that have been made. So there's a couple of different ways to be able to send referrals within CRISP. One way is if you know the name of the organization that you want to send a referral to, you can search it here just by searching the name, or you can use this as very similar to like a Google search by searching through the resources and then minimizing the search radius by address and zip. Once you do that, you'd be able to come up with different options. As you can see here on the left side, we have the source. So the source is kind of that key area. So we have HIE directory. So when you see HIE directory, that will let you know that you can send an electronic referral directly in CRISP to that community-based organization. If you see Maryland 211, you're not able to send a referral. However, you are able to see all their resources. So we have a direct link with Maryland 211 that feeds what's currently in their system into CRISP at all times. And so then you can click down on the program description, get the phone number, the contact information, and a little overview of the program and outreach via that, but it's combining those two resources into one. So if you did want to send a referral electronically through CRISP, you would click the box next to it. This is really small, but as I said, Noreen's going to go through this in more detail. And then you would just click that box, hit create referral, and then the referral form would come up and you would hit submit. We do have specific questions for DPP programs, so diabetes prevention programs, and we have specific questions for the PMER form, which is the postpartum infant and maternal referral form. However, other than that, it's a standardized form that we use. Once that referral is submitted, a confirmation page does come up. You can download that confirmation page, give it to the patient that's receiving, that is getting the referral. And also an email is sent to the CBO, as well as the person that sent the referral. Here's an example right here of that email. So you have that confirmation number and know what referral you're talking about. Then there is management from the community-based organization side of things to be able to manage the different referrals. This is an example of what that dashboard would look like. Again, Noreen's going to go into this into more detail, so I'm not going to spend too much time on it, but here's an example of what that looks like. And then you would come here and be able to manage and submit referrals and update journal information, such as the status of the referrals. So here's an example of what it might look like of a journey for a referral for a patient. So this is all managed by the CBO side, but then also viewable on the provider side, the person sending the referral as well. So notes can be taken, dates can be entered on when and the status of those referrals. So here's an example of what it would look like within CRISP once those referrals are updated. So you would have that date of the referral, where the referral came from. So for example, this is all saying from the internal CRISP system. If it was from Find Help, if it was from a specific organization, it would say the source information there. Then the name of the program, the current status of the program, and then when it was last updated. And then you can go ahead and click on that line item and it will bring up this box where you can get additional information such as the referral sender, the recipient, and then any of those journal entries that I just showed previously. Excuse me. Also on the bottom here, here's kind of our main buckets of referral status. However, there are sub buckets under each one of those. For example, if you choose rejected, you may see things such as unable to get a hold of patient, patient declined services, no funding for the patient. There's a variety of different or did not meet criteria. There's different categories under each of those main buckets of the referral status. So that's really quickly the referral piece, but like I said, Noreen's going to go that in more detail. And we will be sending out these slides. The slides have lots of additional information about HIPAA, non-HIPAA covered, what the process is for onboarding a community-based organization as well to CRISP and sharing information, or if you're interested in the screening and our contact information. There's one other tool that I want to share with you all that's really helpful many times, and we call this the pre-post report. So this is reporting available to organizations that submit. You can submit what we call a panel. So it's more like a patient roster. So those people that are participating in your program, and you can look at the total charges from a hospital. So each one of these, it is grayed out for this one, but each one of these categories of the before after on the left side is a hospital system. So it may say Hopkins here, it may say MedStar here, and it's the patients that they have uploaded, the total charges before providing the CBO service and after providing it, as well as the number of hospital visits, and then the total number of members that are involved in that. So it can actually connect a cost savings to that intervention that's provided to the patient. And you can look at this reporting from 30, 60, 90, 120, as well as a year, both pre and post the intervention. And this is, I will mention all of these tools that I just talked about are free to community-based organizations as well as hospital systems as part of the work that we're doing and the initiatives across the state. So I know that was a lot of information. I'm going to ask if you have questions, please put them in the chat for right now, and I will manage the chat. And I'm going to turn it over to Noreen to give a demo of the system.
Thanks, Michelle. Hey guys, my name is Noreen Elahi. I'm a junior PM for CRISP Maryland, and it's great to meet you guys. I apologize, my voice is a little bit wonky today. I'm a little bit under the weather, so feel free to, chime in if you'd like me to repeat anything or if you have any questions throughout the demo. I'm going to share my screen. Can you guys see my screen? It's just the CRISP portal homepage.
Yes.
Yes.
Perfect. Thank you. So for those who are unfamiliar with our user interface, this is our CRISP web-based portal. And today I'll be going over the SDOH tools that we have available and just show you guys where they are. I can first show you guys how to access our screening tool that Michelle described earlier. To do so, you'd always start off with the patient search, which includes their name and date of birth. This is a test patient, so no worries about recording or anything. And under the list of, in the search results, you'll see a list of the potential patients. You'll click on the patient that you're looking for, and a list of applications will pop up. To head over to our screening tool, you'd head over to screening. And as Michelle mentioned earlier, this is where you could see, sorry, I just have to, okay. So in this tool, this is where you could enter a social needs assessment for your patient. On the left-hand side, this is where you'll see the available questionnaires that we have available. As you can see, there's some very organization-specific screenings. If an organization wanted to have the ability to enter screening directly in CRISP, they worked with Michelle to get that in this tool. And as she mentioned earlier, if this is something that you'd be interested in, please feel free to reach out to her to get that process started. But we do have the general screenings like Prepare and the Accountable Health Communities screening, which you could use right now if you would like. And just to share what it looks like, you would just click on the questionnaire, and on the right-hand side, you would see the actual questions and answers for the patient to complete. And as you can see, it's separated by those different social categories that Michelle mentioned. And I did want to point out there is a patient consent piece involved with each questionnaire. Each patient would need to agree to sharing this data with CRISP in order for the questionnaire to be successfully submitted. And just to show you guys where to see any completed social needs assessments, you would head over to clinical information. All users with clinical access have access to this clinical information tab. And you would head over to social needs data. And you'll see two tabs right here, the assessments tab and the conditions tab. In this tab right here, you'll see all the social needs assessments that were completed for the patient in CRISP, or if the organization has decided to share their screening data from their system to us. And this is a test patient, which is why there's so many assessments right here. But as Michelle mentioned earlier, here we have that orange flag, which indicates if a need has been identified. And you would just click on the assessment you like to view to see the actual questions and answers for each questionnaire and social category. And here under conditions, this is where we house our Z codes. I apologize, the date is typically listed here, and you'll also see where the Z code was generated from, the actual Z code number, and what I think is most helpful is the description, so you can see what the Z code actually is. So here you can see there was inadequate housing, unemployment, etc. Does anyone have any questions about social needs before I move on to referrals? Okay, I'll take that silence as a no, but please feel free to drop anything in the chat. And I'll go over our referral process now. I know Michelle already went over it in detail, but I'd like to show you what everything looks like in the interface. And I think of our referral process in 3 phases. The first phase would be for the user to log into CRISP and find a program to refer their patient to, and then send a referral directly in the system. To do that, they do that patient search that I showed earlier. And when I click on the patient, I'm going to head over to the application called Create Referral. If you don't have access to these tools, please let us know and we can get that sorted out. And in this application, as Michelle mentioned earlier, this is where you could find a program to refer your patient to. And let's see. So for organization name, say I'm familiar or I have a partnership with an organization in the area, I can simply search up that organization here, like Mac Living Well. They're a big CBO in our tool. I could type in their name, click Find Organization. Oh, let me just refresh. Sorry about that. And once I click on Find Organization under the search results, I'll see all the programs that this organization has to offer. Let's say I don't have a partnership with the area, I can always utilize the second search function right here. I just need to know what my patient needs help with. So say my patient needs help with food security, I can put food right here just as a keyword, and I can click search. And under the search results, I'll see all the programs that have services related to food. And I know Michelle already went over these columns right here, so I can show you what the actual referral web form looks like. So say I'd like to send my referral to Mac Living Well, I can just simply click on that checkbox, and I could click on this button that just lit up. It's the Create Referral for Program button, and I'll be directly led to the referral web form. This is the standard referral web form, and it's broken out into a few sections. This first section right here, it's the patient information section. It just has the patient demographic information. And as you can see, most of this information is already auto-populated. The fields with the red asterisk, that means that the field is required in order for the form to be successfully submitted. But there are optional fields like email, spoken language, etc., which could be helpful for the CBO to have. So we do encourage users to input this information if it's readily available. We also do capture patient insurance information now. Carrier type is a required field, and a user has these options to choose from. And in this next section right here, this is where you could enter really any relevant information that you think would be good for the chosen CBO to have that really wasn't captured in this web form, such as maybe the patient has transportation issues, can only do a virtual visit, really anything. It's a free text box. I'm simply just going to put test referral right now. And users are able to attach attachments to a referral, such as for a DPP program, lab results may be helpful for A1C or something like that. Whatever is relevant, a user can attach that document to a referral. And lastly, in this referring provider section, this is just highlighting who exactly is completing this referral. If you're referring the patient yourself, you can go ahead and click on this first button. If you're referring on behalf of a provider, you can click on the second button and you'll be led to search up the provider's name, and their information would be auto-populated in this last section right here. I'm just going to say I'm referring the patient myself. And lastly, this piece that I'm highlighting right here, it's really important. This is the patient agreement piece. So a patient would need to agree to sharing this information with the chosen CBO in CRISP. I know there's not an asterisk right here, but the field is required in order for the form to be successfully submitted. And once I press submit, I'll be led to that referral confirmation page that Michelle showed earlier, and I'll get that email notification that the referral has been sent to the organization. And lastly, we do encourage users to download this form and print it out and hand it over to their patient, just so the patient has the referral details as well. And that ends really the first phase of the referral process. And now begins the second phase where now the referral is in the CBO's hand. And as Michelle mentioned earlier, the CBO will also get an email notification that a referral has been sent to one of their programs. And so that could prompt the CBO to log into CRISP. CBOs,
Hey, Noreen,
yeah.
Can we just pause here? I just want to see if there's any questions on sending a referral about the directory. We do get the question a lot of who's in the directory. So currently we have about 50 different organizations in our directory that receive electronic referrals, and that includes about 100 different programs. If you need that list, please let me know, and I'm happy to share that information with you. Also, if there's an organization that, if you're a community-based organization that wants to receive referrals through CRISP, or you would like to send to an organization that's not on here, please let us know and connect us, and we're happy to onboard them. We also provide the training. We have resource materials. We have videos as well on how to use and manage the system as well. But I did want to pause here if there's just any questions about this. All right, so Noreen, I'll turn it over to you to share about the management of the referrals then.
Sounds good. Thanks, Michelle. And so CBOs, they have access to a tool called Manage Referrals. I apologize, I'm just trying to find it in my list. Here it is. And so to view any referrals that were sent to your programs, or to manage your referrals, you'll go ahead and click on that application, and you'll be led to this table right here. We call this the work list, and this is where you could see all the referrals that were sent to any one of your programs, all consolidated in this one table right here. At a quick glance, you'll see the name of the patient, their gender, their date of birth, who had sent the referral, when the referral was sent, and the status of the referral as well as when it was last updated. And you'll also see the name of the program as well. To view the actual referral, you'd simply just click on the row, and you'll be led to the referral web form that was sent to you. And this is where you could get that phone number to contact that patient to see if they would like to be enrolled in the program. And if you scroll down to the very bottom, sorry, let me try finding a referral that wasn't worked on yet. Okay. So if you scroll down to the very bottom, this is where you would see the journal information section, and this is where you could make any updates to the referral as necessary. And so if you'd like to accept the referral, you'll click on accept. And in this section right here, create new journal, this is where you could make any updates and make any notes to any changes that were made to the referral, such as maybe you had called up the patient and they would like to be enrolled in the program. You can click enrolled. And in this journal section right here, this is where you could just write a respective note for that status, such as maybe you contacted the patient today. They'll like to enroll in the program. Their first appointment, their first visit will be 7/26. Really anything that would be relevant to that status change. And once you click submit journal, that note and update would automatically be populated in this table right here. And this table is just a very easy way to see a journey of the referral. And you can always go back to your work list to make any updates to any of the other referrals that you received. And I would like to point out that you can download this referral data. Currently at this state, users are only able to download this data you see in this table right here, but we are working on users being able to download all the referral information that you had received in the referral. And so this really ends the last stage, this ends the second phase of the referral process where the CBO is managing and updating the referral, and now begins the last and third phase where a user can actually see these updates to the referral on their own end. All users with clinical information can access this tool called Referral History. And in Referral History, this is where you could see all the referrals that have been sent for your patient in CRISP. And this is where you could see those updates that a CBO has made to the referral. This is for a test patient, which is why, again, there's so many referrals right here, but at a first glance, you'll see when the referral was sent, the name of the program, the most recent status, and when it was last updated. And then you would simply just click on the referral to see more updates to the referral of who had sent it, where it's going to, and those journal entries. And we just call this the closed loop referral tool just because users are able to see any updates that were made to the referral. They're not necessarily left out wondering, what happened to my patient? Did they even get enrolled, etc. And I would say this is really our referral process in a nutshell. Did you guys have any questions or would like to see anything more in detail? I do realize I threw a lot of information at you.
Okay. If anyone is interested in adding this to your tool or connecting with CRISP through your current tool that you're using and sharing that information, or using the assessment or screening, or you work with an organization right now that you send them faxes to, or just an email or a phone call to send referrals, and you would love to easily send it electronically, connect us with them. We're happy to have those conversations and lead those conversations. As I said, we have lots of training materials available. Noreen handles all the onboarding for new CBOs and completes all that paperwork and gets everyone the permissions that they need. And again, this is completely free and available. We're really just wanting to build our network and share, being really able to share and not duplicate referrals to different organizations, and really ease the ability to get connected to resources. So if you're interested, please, send us an email. I sent Kim the slides so she can send those out to everyone as well. Kim, I see you have a question.
Yes, I just wanted to ask on behalf of community-based organizations. So if an organization receives a referral through CRISP, do they just need to check into CRISP regularly to see if there's new referrals, or is there a way to automate like a notification outside of CRISP?
Yeah, so they'll get that email that says that a referral has come through. So you'll get an email to alert you. We do ask when you sign the contract that you'll at least log in once a week to manage the referrals, because one of the things that is really important to us is that closed loop side of things. So, many of the other tools out there, that's not really necessarily a requirement, but really that's the thing we focus on, is making sure we're able to show like what's happening with the referral. And so we do ask that you at least log in once a week, but you will get that alert, because sometimes, depending on the organization, you might only receive 1 or 2 a month, depending on who you're receiving it for. And others, we have some that receive 300 to 400 referrals a week. It really depends, and they're working in it every day. Some organizations use this to also help supplement. So maybe they're working within their own system, but they want to receive referrals or start the digitalization process of that to see how it goes. Others may just use it for a specific grant. So we do have reporting available as well to show like the volume of referrals for a certain program, the status of those referrals, and updating that information, as well as where the referrals are coming from. So many times we'll use this tool for grants or different specific funding sources as well. Yeah, surely.
Hi, good morning.
Morning.
Very excited that you're here today, certainly. CRISP is always at the top of everyone's mouth, and many of our meetings. So can you talk a little bit about the process I'm with the health department, but the process for the CBOs to actually get access to CRISP and what that looks like?
I'm going to turn that over to Noreen. She's our expert in that area.
Yeah, I can talk about that. So for a CBO to get access to CRISP, there's just a few documents that will need to be completed. And it really depends if the organization is a HIPAA covered entity or not. That might change a couple of things. But if it's a non-HIPAA covered entity, we'd have them sign a memorandum of understanding, MOU for short. If they're a HIPAA covered entity, we'd have them complete a participation agreement with us. And if it's a CBO that like to receive referrals, they'd complete an additional document called the program description form, which just describes the referral process and that they agree to abiding to that process. And then I'll send over a spreadsheet where they could list the programs that they would like to have available in our program directory, as well as their respective program description. And that's pretty much all the documentation that would be needed. And then I can provide any trainings that people would like for CRISP in general and CRISP referrals specifically. And I'll be their account manager from there on out. So if you have any questions about CRISP or account issues, you can always reach out to me afterwards.
Wonderful. I'm definitely going to reach out. I oversee population health programs here at the health department, and our assistance in community integration services program. It's a Medicaid program, but we work with those who are chronically homeless. And so we have several community-based organizations and government entities that provide housing and tenancy-based services to our housing insecure residents. And then our CHISP program as well. I would like to get our community health workers access as well. So I will be in contact, I can tell you that much.
Awesome. We
Okay.
look forward to working with you.
And I had one more question in the chat, but forgive me if you said this. Can organizations also refer to other providers? So if a primary care provider referred someone to a food assistance program and then they identified that there could be a need for behavioral health or mental health services, how would that process work?
Yeah, so community-based organizations do have access to send referrals as well. So they're able to search the directory and send referrals and use that as kind of an ongoing piece of that. We do also even have, I think, some of the free or reduced price clinics in here as well. So you can also refer to connect with a primary care appointment if you need to. That's an option as well. But yeah, absolutely. So we always ask from both sides. So who do you receive referrals from, as well as who do you send referrals to? So really, how can it be really more of a one-stop shop for you all? So then it doesn't have to be, well, I'm working here, but then I still have to call here, and really getting kind of more of a system of everyone kind of using it to help facilitate those referrals and seeing the full journey for the patient. Let's see. I see. Is there a cost associated? Nope, there is no cost associated with CRISP from the CBO side. And there's no cost for the screening or customization. And as of right now, there's no cost for that pre-post reporting as well. So it's really exciting that the state has allocated money to be able to provide these services to you all for free.
And does the referral go beyond the state? I know you work in DC and Virginia, you mentioned. So can we refer people to services in other states?
So we're working on that. So part of the issue we have with that currently is each HIE is its own identity, right? Like, so we definitely hear that, especially from a DC standpoint. So there's a couple of workarounds that we can do that. We can have that organization have two logins, right, through CRISP DC and CRISP Maryland, because they're technically two separate HIEs. Now, if it's a person part of their care team, so let's say it's a provider and they wanted to see, they have access to, if they're part of the person's care team, they will see all the different states' information. But the being able to manage the referrals and send the referrals, those are actually separate at this time. But we have heard that come up, and we'll continue to look at some additional solutions for that. But we do have kind of a workaround for that right now. Anyone else? If anything comes up afterwards, feel free to send me an email. I included it here in the chat. I'll put it again here at the bottom with all of our information. And then it's also in the slides that will be sent out as well.
And I see one more clarification question from Sharon.
Let me see. Yes, from a medical standpoint, if you're a part of the member's care team, it is across the different jurisdictions.
Great. Well, thank you so much for joining. This was extremely informative and aligns very nicely with the goals for our group. So we have recorded the session as well, so people will be able to kind of walk back through your tutorial. Really appreciate your time, and hope that lots of organizations get onboarded.
Thank you so much.
Thank you, guys. Have a good day.
You too. All right. Well, I hope everyone benefited from the information. We're now going to go ahead and open up to community announcements. It's from announcements that were sent on behalf of our partners. We received a save the date for a back to school jam and health fair at the Langley Park Community Center on August 17th. They are looking for additional vendors. So if you would like to offer services or attend this event, you can, we'll be sending this out with the notes. It'll also be available in our next week's newsletter, but you can email Norberto Martinez. His email address is available in the form. And then what organization you're from and what services you'd like to provide. And our next meeting will be August 22nd at 11 a.m. So we look forward to seeing you all there. I'm going to pass it over to Dr. Carter for closing remarks.
Thank you, Kim. I hope this was informative. We've had a long history with working with CRISP, and this work has been, especially the referral, e-referral, since since 2018 when we first tried to create a bidirectional e-referral system for our diabetes and hypertension programs. And so it's progressing. It's really, really important that you utilize this because CRISP is a very foundational piece in our state. And it's in the e-referral system. There's a lot you can do with it and grow it. And you have to, once you use it and you find you have multiple needs from it, especially when you have a program that you might have gotten funded for, et cetera, you need to be able to work with CRISP to help them continue to grow out the application. If you look at the referral application that they have now, it's still in its formative stage. You can make a referral back and forth, but there's a lot more you can do with e-referrals to help you manage your care coordination and optimize your care coordination. So as we go through what we're doing, especially when we go through our use cases, et cetera, we have to be sure to keep that what we've heard, how CRISP can deal with referrals, and then what additional things, how do we make it as robust as we can so we can get the best care for our patients. So that's the most important thing. So it's the one of the major reasons that we introduced CRISP now is because we realized, one, that a lot of people don't know all of the things that CRISP can do. I mean, it can do quite a number of things. And, you know, and as we move forward, we have to be sure to keep them at the table as well as we integrate them into our functioning moving forward. So I hope this was helpful, and it gives us a foundation to build upon as we, you know, continue our work. So I just like to thank you all for coming and paying attention and making sure that we keep moving in the right direction. Thanks, Kim.
Thank you, Dr. Carter. And I didn't really give a lot of time. Did anybody have any additional community announcements they wanted to share before we log off? Okay, if nothing comes to mind, I want to put our email address in the chat, so you can always send your community announcements to our email, the coalition email address, or you can put them on our website. We have a calendar of events that you can add to share with the community. So here's our email address there. All right, I hope you all have a good rest of your day and a wonderful weekend.
You guys too. Have a great weekend.
Thanks, everyone.
Thank you.
Have a great day.
Thank you.